Hello, my name is Nancy Jacob. I'm a nurse practitioner student from United States University, and I have to do a neurological exam. I have my volunteer here. I'm going to get his consent, but before this, I'm going to go ahead and wash and sanitize my hands. Hi,
Hello.
my name is Nancy. I'm a nurse practitioner student from United States University. I have to do a neurological exam. And do you consent to be examined, answer questions, and then have this video recorded and uploaded on YouTube as unlisted for my professor to see and grade?
Yes.
Thank you. Can you verify your name and birthday?
My name is Aaron, and I was born December 13, 1997.
Okay, good. Do you have any questions or any concerns right now?
No.
Okay, thank you. So I'm going to ask you some questions, okay? Well, can you tell me what date it is today?
Today's date is August 2nd, 2023.
Thank you. And what state are we in?
We are in California.
And who is the current president?
Joe Biden.
Okay. And I'm going to ask you some memory questions, okay? They're just simple ones. What did you have for breakfast today?
I had a chicken bake from Costco.
Okay. And what school did you go to in preschool?
Heritage Christian Schools.
Okay, good. And what if you go to the gym, you went to the gym and then you went on a treadmill and you found a cell phone on that treadmill that you just got on? What are you going to do?
Turn it into Lost and Found.
Okay, well, that's good. So based on the patient's answers, I could conclude that his level of consciousness is he's awake, alert, and he's oriented to name, person, place, date, time, and situation, and that his speech is clear and it's coherent, and his memory is intact, his recent and remote memory, and his reasoning is appropriate, and his judgment is clear. So now I'm gonna perform the testing on the cranial nerves 1 to 12, starting with cranial nerve 1 olfactory. So I'm gonna have you cover each nostril while your eyes are closed and tell me what you smell, okay? So first cover your right nostril. Okay. Oh, by the way, I am recording this video on the selfie mode of my phone.
Coffee grounds.
Good. Okay. And the other nostril.
Cinnamon.
Good. Okay, so cranial nerve 1 olfactory is intact. So next I'm going to test for cranial nerve 2. I'm going to have him read the lowest letters he can read on this pocket Snelling chart. I'm going to be standing 6 feet away. And then I am going to test his peripheral vision by confrontation. And then I'm also going to check a fundoscopic exam. Okay, so first I am going to have him read the last letters he can see. Since he's wearing glasses, are those for correction? Okay, so since he's wearing glasses, he's gonna use those when he reads the Snellen chart. So I'm gonna need you to cover one eye first, the right eye, okay? And then you cover the other eye later, and then you test with both eyes, okay? So, okay, what is the lowest letters that you can see?
LTFPH.
Good. Okay, and then the other eye.
LTFPH.
Good. Now uncover both eyes.
LTFPH.
Good. Okay, so his visual acuity is 20/20 with corrective lenses. So now I'm gonna check for the peripheral vision by confrontation. So I'm gonna wiggle my fingers coming from behind, and you're gonna tell me if you can see them, okay? So you're gonna cover right eye first, and then the left eye, and then uncover both eyes, and we'll do the same test, okay? And you'll tell me, say yes when you see my eyes. Okay? Okay. Good. And the other eye, cover the other eye. Okay.
Uh-huh.
Okay, good. Now uncover both eyes. Okay. Say yes.
Yes.
Okay.
Yes.
Okay, good. So peripheral vision is intact with corrective lenses. So now I'm gonna check the inside of your eyes, okay, using the ophthalmoscope. So I'm gonna um, use my right hand, my right eye, checking the patient's right eye, and then my left hand on with the ophthalmoscope on my left hand with my left eye and the patient's left eye. So for this test, it is ideal to dim the lights, but for this purpose of this video, I'm just gonna keep the lights on. Okay, but it's ideal to dim the lights when we do the fundoscopic test. Okay, so I'm gonna test your right eye. Okay, um, are you okay to remove the glasses? So I'm gonna check for the red. I'm gonna check for the red reflex. I'm gonna check for the retina, the red orange color, and the cup to disc ratio, which is 1:3. Check for the disc margin. I'm gonna check for the blood vessels, if there's any hemorrhaging, any AV leaking, or any cotton wool spots. So I'm gonna check both eyes for those. So my right eye with the patient's right eye. And I'm gonna have my fingers bracing against the cheek so I don't. Okay, good. Okay, hold. Okay, and then the other eye. All right. Okay, good. So both eyes have red reflex present. The retina color is reddish orange on both eyes, and I was able to visualize the cup to disc ratio, which is 1:3 on both eyes. The disc margins are sharp on both eyes. I didn't see any hemorrhaging or AV nicking on the blood vessels on both eyes, and there's no cotton wool spots on both eyes. So that's good. So the cranial nerve 2 optic nerve is intact. So the third cranial nerve is the oculomotor nerve. So I'm going to be testing for the ocular motions. And also I'm going to check the pupillary reaction by direct and consensual light using my pen light. And I'm also going to check for nystagmus as I check the ocular motions. So I'm only going to be doing the cranial nerve 3 right now. So you're going to look at my pen and you're only going to follow my pen with your eyes. Don't move your head, okay? All right. So good. 3. Good. 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 Okay. Good. So his those superior and inferior motions are intact. Okay, and I didn't see any nystagmus. And if there's nystagmus, I would have counted the beats. So now I am going to check for the pupil reaction by direct light and by consensual light. Okay, so direct light is if I light the pen light directly on his pupils, they will constrict, and consensual light, if I light it directly on the right eye, the left eye, which is the opposite eye, will constrict. So I'm gonna go ahead and do that now. Go ahead, can you remove your glasses? Okay, good. Okay, good. All right, so pupil reaction by direct and consensual light are intact. Okay, and so now I'm going to check for the cranial nerve 4, which is the trochlear nerve, checking for the downward and the medial motion of the eyes. Okay. So go ahead and look at this. Okay, good. So cranial nerve 4, trochlear nerve is intact. So now I'm gonna check for the trigeminal nerve or cranial nerve 5. So I have this sharp and dull portion. I'm gonna touch it on your face, and you're gonna tell me if it's dull or sharp. Okay? Close your eyes. Yes. And tell me what it is.
Dull.
Okay.
Dull. Sharp.
Good.
Dull. Sharp. Sharp.
Okay. Good. All right. And then can you so I'm just gonna test the opening of the jaw with resistance with his mask on, because I don't want him to get infected with COVID. But I can feel if he opens his jaw with resistance. So go ahead and open your jaw. Good. Okay, so his jaw is strong. He was able to open his jaw against resistance. Okay, now I am going to check for cranial nerve 6, the abducens nerve, which is the lateral motions of the eyes. So again, you're gonna look at my pen light with just your eyes. Good. So the patient was able to move his eyes on lateral motions without any problem, with no nystagmus. So next, I'm gonna check for cranial nerve 7, which is the facial nerve. And to check that, um, I'm going to uh, have him wrinkle your forehead. Okay, good. And then, can you smile or you frown? Okay, good. All right. Okay, and now the next cranial nerve is cranial nerve 8, which is the acoustic nerve. So I'm gonna have him repeat after me as I whisper from 2 feet away, with while his one ear is closed, when he's palpating his tragus on one ear. Then I'm gonna have him repeat the letters or numbers that I say on each ear, and then I'm gonna do a Weber and I'm gonna do a ring test. Okay, so I'm gonna go behind you. Okay, so hopefully, okay. So go ahead and cover one eye. I mean, sorry, one ear. One ear, okay. And palpate your tragus like this. Yeah, there you go. And then I'm gonna whisper and you repeat after me. 1, 2, 3.
1, 2, 3.
Good. And then the other ear. 4, 5, 6.
4, 5, 6.
Good. All right. So now I'm gonna check for the Weber test. So you're gonna tell me if you hear the sound equally or you hear it more on the other ear, okay? I'll put it on your head.
Equally.
Okay, good. Then I'm gonna do the ring test to check for air conduction and bone conduction. I'm gonna put it on the mastoid bone behind his ear and adjacent to his ear for the air conduction. Tell me when it stops.
Stops. To hear it.
Okay, good.
Stops. To hear it.
Okay, good. All right, so his cranial nerve is intact. And with the ring test, the air conduction is greater than bone conduction. And then for the Weber test, there's no lateralization on each ear. So he has a intact cranial nerve 8. So now I'm going to check for cranial nerves 9 and 10. Cranial nerve 9 is um, glossopharyngeal, and cranial nerve 10 is vagus nerve. So I'm going to have you swallow. Go ahead and swallow. Good. Okay. And for the purpose of this video, I'm not gonna test for his gag reflex, but to test the gag reflex, um, the patient's mouth needs to be open and with a tongue depressor to that's how you check the gag reflex is with the tongue depressor and touching the back of his throat or the uvula. Okay, and then can you go ahead and open your mouth and say ah? Good. Okay. So cranial nerve 9 and cranial nerve 10 are intact because when the patient said ah, the uvula moved and there was no deviation on his uvula. Okay, so next is cranial nerve 11, which is spinal accessory. So um, I'm gonna have you shrug your shoulders against my hands, okay? And I'm gonna test your trapezius. Good. Okay, and then I'm gonna check your sternocleidomastoid muscles on your neck. I'm gonna put my hand and you're gonna turn your head against resistance. Good. Okay, good. So his cranial nerve 11 spinal accessory spinal accessory nerve is intact. So now I'm gonna test for cranial nerve 12, which is the hypoglossal nerve. And I'm gonna need you to remove your mask if you don't mind. And you're gonna show me your tongue. Okay, it's midline and move your tongue side to side. Good. And now push your tongue against your cheek. Good. And the other side. Good. Okay, you can put your mask back. Great. So spinal nerve 12, hypoglossal is intact. So all of his cranial nerves 1 through 12 are intact. So now I am going to check the cerebellum. So I'm gonna have you stand up. I'm gonna check for the general gait. I'm gonna have you stand up and just walk around back and forth, and then after that, you're gonna put your heel in front of your toe, and then you're gonna go around in front of do the tandem walk. That's what it's called. Okay, heel in front of toe is tandem walk, and then you're gonna come back and walk with your heels, and then come back and walk with your toes. Understand? Okay, good. All right. Good. And now do the tandem walk. Heel in front of your toe. Good. Good. No, like this. Heel in front of your toe. Okay. Like this. Okay, good. Perfect. Good. Good job. Good. And now walk with your heels only. Good. Okay, and now walk with your toes only. Good. Good job. Okay. So the next test I'm gonna do is the Romberg test, which tests for ataxia. So I'm gonna need you to keep standing though. Go ahead and keep standing. I'm gonna test for the test for the Romberg test. Go ahead and stand right here. And uh, so with this, I'm also gonna check for the pronator drift. But I'm gonna have you close your eyes and then put your hands in front of you with palms up. Palms up. Raise arms in front of you with palms up. Okay, and then close your eyes. All right, and then count 1 to 10. Can you count 1 to 10?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, good. All right, good. We're done. Go ahead and put your arms up. Okay, so the Romberg test and pronator drift test is negative because he didn't have any swaying or didn't have any balance problem. Okay, so go ahead and have a seat. So next, what we're gonna do is we're gonna do uh, hand to lap, and do it as fast as you can, like this. Okay, good. All right, perfect. Okay, so his cerebellum is intact because he was able to perform all of those tasks without difficulty. So now I'm gonna check the sensory system. Okay, so I'm gonna check the joint position sense or proprioception sense. So I am gonna need your foot on my thigh here. So with your eyes closed, I'm gonna raise your toe or um, push it down, and you're gonna tell me if I am pointing up or down. Okay? Okay.
Down,
Good.
up,
Good. And then the other one. Okay. Good. Your eyes are closed. That's good.
down, up.
Good. All right. That's good. So he was able to do that. And then next, I am going to do the 2 point 2 point discrimination. So I am going to have this touch your arms and your legs. Okay. So, but if you feel this, that's 2 point. If you feel that, that's 1 point. But you need to have close your eyes. Okay. So you're gonna tell me if it's 1 point or 2 point.
2, 1, 2, 2, 1, 1, 2, 1, 2, 1, 2.
Good. All right. That went well. Okay, now I'm gonna check for graphesthesia. I am going to write something on your hands with your eyes closed. You're gonna tell me what I wrote. Okay.
The number 8.
Good.
The number 2.
Good. All right, that's good. Okay, so the next, I am going to check your, I'm gonna check the upper and lower extremities. Um, I'm gonna have this cotton ball touch you, and you're gonna tell me if you feel it, okay? And then also for the tactile pain sensation, I'm gonna touch this pin, and you tell me if you feel the prick, okay? All right, so with your eyes closed. So first I'm gonna do the upper extremities, and then next I'm gonna do the lower extremities.
Soft, prick, 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 soft, soft, soft,
Good. Okay, now the lower extremities, the same thing.
prick, prick, soft, soft, prick, soft, prick, prick, soft, soft.
Okay, good. So now I'm gonna check for the vibration sense. You're gonna tell me if you feel the vibration on your toes and on your fingers. We'll just do one finger and one toe.
Mm-hmm.
Okay.
Mm-hmm.
Good.
Mm-hmm.
Yes.
Yes.
Okay. Good. Okay. Good. So now I can conclude that his sensory system is intact because he was able to perform those activities with no difficulty. So next, I'm gonna check for the motor system. I am going to check the strength of his deltoid, his biceps, and his triceps. I'm gonna check the strength and compare them side to side. So you are going to do the opposite motion of what I do. If I push in, you push out. Okay? So I'm testing for the strength. Okay, so go ahead and turn towards me. Okay, so first I am going to check your deltoids. Okay, so I'm gonna push in and you push my hands out. Good. Okay, right. And then I'm gonna check your biceps. Okay, so I'm gonna push towards me and you push. There you go. Okay, and then there you go. Okay, good. So his deltoids and his biceps and his triceps are intact. So now I'm going to do the hand grip. Okay, so you grip my hand. Okay, tight. Okay, good. His hand grip is really strong. Okay, and you're gonna open your fingers and don't let me close them. Okay, good. So his fingers are really strong. Okay, so now I'm gonna check for the lower extremities. I'm gonna check for the strength and compare the muscles side to side, starting with the quadriceps and then the hamstrings and then his hip abduction and hip adduction. Okay, so um, go ahead and put your hands on your side. Okay, so I'm gonna push down and you push up. Good. Okay, I'm gonna push up and you push down. Good. I'm gonna push in and you push out. Good. I push out, you push in. Good. And then I'm gonna check for the hip abduction. So I'm gonna push in, you push out. Good, good, good job. So um, the muscles on his upper and lower extremities are really strong and they're symmetrical. They have symmetrical strength. Okay, so now I am going to check for his reflexes. I'm gonna check for the Babinski reflex. I'm gonna check his biceps, his triceps, his patellar reflex, and the Achilles reflex using my uh, reflex hammer. I'm gonna check the Babinski reflex first while I'm sitting down. So go ahead and put your feet up here. So I'm gonna check both of them. Okay, good. So there's no dorsiflexion of the big toe, which is normal. Okay, good. There's no dorsiflexion of the big toe, which is normal. So now I'm gonna check your biceps reflex. I'm gonna find that biceps tendon. Okay, good. And then check for the triceps. Okay, good. Okay, good. Okay, good. So his reflexes on the biceps and the triceps are normal. So I'm gonna check for the patellar and the Achilles reflex. So yeah, go ahead and let them hang. And then you're gonna put your hands, hold your hands together. Okay, okay, good, good. Okay. And then I'm gonna check for the Achilles reflex. Okay, good, good. Okay, so all of his reflexes are intact. They're not hypo or hyper reflex, so which is good. So this is the end of our testing. Everything went well. Everything was normal. Do you have any questions or any concerns?
Nope.
Okay, good. Thank you for your cooperation. I appreciate it. Thank you.